Hey, I want to ask you something really quick. When was the last time your doctor checked your blood pressure? Last month? Last week? Maybe even this morning? And when they read you those two numbers, did they explain what both of them actually mean? Did they talk about the relationship between them? Did they calculate the difference and tell you what that difference says about the health of your arteries? I am going to guess the answer is no. Not because your doctor does not care. They absolutely do. But because there is simply not enough time in a standard appointment to explain everything that two little numbers on a blood pressure cuff are actually telling you. Today we are going to fix that together. By the end of this video, you are going to understand your blood pressure reading in a way most people never do. You are going to know how to calculate one simple number that tells you more about your cardiovascular health than either of those two readings alone. And you are going to know exactly what to do about it. It is simpler than you think, and it could genuinely change the conversation at your next checkup. Stick with me, this one is important. You know what I hear all the time from people? They say, my blood pressure is fine. My doctor checked it and said the numbers look okay, so I am not worried about it. And I completely understand that feeling. When a doctor tells you something is okay, you feel reassured, you move on, you trust the system. But here is the thing, blood pressure is not just two individual numbers. It is a relationship between those numbers. And that relationship, the gap between your top number and your bottom number, tells a story that neither number tells on its own. Think of it this way. Imagine you are checking the temperature in your house. You look at the thermostat and it says 70 degrees. Sounds comfortable, right? But what if I told you that 2 hours ago it was 45 degrees? That 25-degree swing tells you something important, something the current reading alone does not. Your blood pressure works the same way. The gap between your highest pressure and your lowest pressure with each heartbeat tells you how hard your heart is working and how flexible your arteries actually are. That gap has a name. It is called pulse pressure, and it is one of the most underused, underappreciated, and most important numbers in cardiovascular medicine today. So what exactly is pulse pressure, and why does it matter so much? Let me break it down in the simplest way possible. Every time your heart beats, it squeezes and pushes blood out into your arteries. That squeeze creates pressure, and that peak pressure is your top number, which doctors call systolic pressure. Between beats, your heart relaxes and refills. During that resting moment, the pressure in your arteries drops to its lowest point. That lowest point is your bottom number, diastolic pressure. Now here is where it gets interesting. The difference between those two numbers, top minus bottom, is your pulse pressure. So if your blood pressure is 130/75, your pulse pressure is 130 minus 75, which equals 55. Simple as that. Now why does that gap matter so much? Because it tells you how elastic or how stiff your arteries are. Here is a simple way to picture it. Imagine squeezing a brand new rubber balloon. It stretches easily, absorbs the pressure, and springs back gently. Now imagine squeezing a plastic bottle. It barely gives. The pressure has nowhere to go. Young, healthy arteries are like that balloon. When your heart pushes blood through them, they stretch slightly to absorb the force. This keeps the pulse pressure relatively modest. The gap between top and bottom stays in a comfortable range. But as we get older, or if we have had years of high blood pressure, or high cholesterol, or diabetes, those arteries gradually stiffen. They become more like that plastic bottle. Less give, less cushioning, less ability to absorb the pressure wave from each heartbeat. When that happens, the top number tends to rise because there is nothing cushioning the pressure spike, and the bottom number tends to fall because the stiff arteries cannot maintain pressure between beats the way elastic ones can. Top goes up, bottom goes down, the gap widens. And that widening gap, that increasing pulse pressure, is your arteries telling you something very important about their condition. Here is the really good news. You can figure out your own pulse pressure right now. No doctor needed, no special equipment, just your last blood pressure reading in about 10 seconds. Take your top number, subtract your bottom number. That is your pulse pressure. Let me give you a few examples so it feels really clear. Blood pressure 128/78. Pulse pressure is 128 minus 78, which equals 50. That is a healthy normal range. Blood pressure 145/70. Pulse pressure is 145 minus 70, which equals 75. That is elevated and worth paying attention to. Blood pressure 122/58. Pulse pressure is 122 minus 58, which equals 64. That bottom number looks fine on its own. That top number looks fine on its own. But that 64-point gap is telling you your arteries may be losing some of their elasticity. Here is the range you want to know. Below 40, too low, can signal heart problems, worth checking. 40 to 60, this is the healthy sweet spot. 60 to 70, mildly elevated, worth monitoring and mentioning to your doctor. 70 to 80, significantly elevated. Have a specific conversation with your doctor soon. Above 80, this needs medical attention. Go ahead and calculate yours right now if you have a recent reading nearby. I will be right here. Okay, so now you know what pulse pressure is and how to calculate it. But why should you actually care? What is it doing to your body if it stays elevated over time? This is the part one really want you to hear clearly because it connects to so many things people experience as they get older and never realize are related. Your brain. Your brain is incredibly sensitive to pressure. It has a vast network of tiny delicate blood vessels that are designed to receive blood at a steady regulated flow, not at amplified pressure spikes. When pulse pressure is high, every single heartbeat sends a stronger pressure wave through those tiny brain vessels. Over months and years, this causes microscopic damage. Tiny areas of brain tissue quietly lose their blood supply. Small silent changes accumulate. Research has consistently linked elevated pulse pressure to faster cognitive decline, increased risk of memory problems, and higher rates of both obvious and silent strokes. Here is what really hits home for a lot of people. Many seniors who notice they are becoming more forgetful, that their thinking feels a little slower, that they are not as sharp as they used to be, they assume it is just normal aging, and sometimes it is, but sometimes it is the result of years of elevated pulse pressure quietly affecting the blood supply to their brain, and that is something that can be addressed. Your kidneys. Your kidneys filter your blood through incredibly fine microscopic vessels. They are pressure sensitive in exactly the same way the brain is. Elevated pulse pressure over time damages those filtering vessels and contributes to the gradual decline in kidney function that affects so many people over 60. If any of the kidney warning signs we discussed in previous videos ring a bell for you, the morning eye puffiness, the foamy urine, the persistent fatigue, it is worth knowing that elevated pulse pressure and kidney decline often go hand in hand. They are part of the same underlying process. Your heart. When your arteries are stiff, your heart has to work harder with every single beat. It is pushing against resistance rather than into a system that helps it along. Over years of this extra effort, the heart muscle itself changes. It thickens. It becomes less flexible. It becomes less efficient at filling and pumping. This is called left ventricular hypertrophy, and it is a significant contributor to heart failure, one of the most common serious conditions affecting people over 65. The good news. Here is what I really want you to take away from this section. Arterial stiffness is not a fixed, irreversible condition. It responds to lifestyle. It responds to the right medications. It responds to specific nutritional interventions. The earlier you catch it and address it, the more you can do about it. While elevated pulse pressure becomes more common as we all get older, there are certain groups of people for whom this is especially urgent. If you have had high blood pressure for years, even if it is currently well managed, your arteries may have already accumulated stiffening from those years of elevated pressure. Your pulse pressure is worth checking even if your current readings look acceptable. If you have type 2 diabetes, this one is really important. Elevated blood sugar over time causes a process called glycation, where sugar molecules chemically attach to the proteins that give arterial walls their elasticity. Diabetic arteries stiffen faster than non-diabetic ones. If you have diabetes, your pulse pressure deserves regular monitoring as part of your routine care. If your cholesterol has been elevated, arterial plaque contributes directly to arterial stiffening. The higher the plaque burden over the years, the more stiff the arteries become, and the wider the pulse pressure tends to be. If you have been relatively inactive, regular movement genuinely helps maintain arterial elasticity. Even moderate walking has measurable benefits for artery health. Prolonged inactivity accelerates stiffening, and if you have smoked or currently smoke, smoking causes direct chemical damage to the elastic fibers in arterial walls. Former smokers can carry elevated arterial stiffness risk for years after quitting. Alright, let us talk about what you can actually do. Because knowing about a problem without knowing how to address it is not particularly helpful. Get a home blood pressure monitor. This is honestly one of the best things anyone over 55 can do for their health. They are widely available and cost between $30 and $50. Take your blood pressure at the same time each morning before eating or taking medication. Write down both numbers. Calculate the pulse pressure. Track it over weeks. One reading tells you very little. A pattern over weeks tells you a lot. Have a better conversation with your doctor. Next time you are at a checkup, do not just ask whether your blood pressure is controlled. Ask specifically about your pulse pressure. Use those words. What is my pulse pressure? And what does it tell you about my arterial health? That question signals that you want a more complete picture than a routine checkup typically provides. Most doctors will respond very positively to an informed patient asking the right questions. Move your body regularly. I know you have heard this before, but specifically for arterial stiffness, the evidence for regular moderate aerobic exercise is genuinely impressive. Walking, swimming, gentle cycling, 30 minutes most days. Research consistently shows this reduces arterial stiffness and improves pulse pressure over time, independent of its effect on weight or overall blood pressure. Add some specific foods. Beetroot, leafy greens like spinach and arugula, and celery are rich in dietary nitrates. Your body converts these to nitric oxide, which relaxes and widens blood vessels and helps restore some arterial elasticity. Adding these to your diet regularly has measurable effects on arterial health. Oily fish like salmon, sardines, and mackerel, or a good quality omega-3 supplement have anti-inflammatory effects on arterial walls that help preserve their flexibility over time. Reduce your sodium intake. We talk about sodium a lot in the context of blood pressure, but it is specifically relevant to arterial stiffness too. Sodium affects the structural proteins in arterial walls directly. Lower sodium intake over time genuinely helps preserve arterial elasticity beyond its effect on blood pressure numbers. If you are diabetic, make blood sugar control your top priority. Every percentage point reduction in your HbA1c reduces the rate at which elevated blood sugar is chemically stiffening your arterial walls. This is one of the most direct and powerful interventions available to diabetic patients for protecting their arterial health. Here is what I love about this topic. Most people come away from a blood pressure conversation feeling like they either passed or failed a test. The number is either okay or it is not. But understanding pulse pressure gives you something much more useful. It gives you a window into what is actually happening inside your arteries. It gives you a specific number to track and improve over time, and it gives you a much richer conversation to have with your doctor. You are not just monitoring a number. You are understanding your body. Your action steps from today are simple. Find your last blood pressure reading and calculate your pulse pressure right now. Top number minus bottom number. If it is above 60, write it down and bring it up specifically at your next appointment. Start taking your blood pressure at home regularly if you are not already. Add one arterial protective habit this week. A daily walk. Some beetroot or leafy greens. A reduction in processed foods. And share this video with someone you know who monitors their blood pressure, because they are probably checking the right thing the wrong way too. Leave me a comment below telling me your pulse pressure number. I genuinely read every single one, and knowing where you are helps me understand what to cover next. Take care of those arteries. They have been working hard for you every single day. See you in the next one.